This is Dr. Porter from Mayo Clinic, Florida. And I'm speaking to you about my JBJS article, Tranexamic acid was not associated with increased complications in high-risk patients with hip fracture undergoing arthroplasty. This study came about from a number of common clinical scenarios that we have all faced, the high-risk patient with hip fracture. We looked at about a decade's worth of hip fracture patients and identified high-risk characteristics such as a history of a cardiac stent, a history of a DVT, stroke, etc. And we separated out high-risk patients and then further separated them by receipt or administration of tranexamic acid or TXA. We did not find any signal that the administration of TXA or tranexamic acid was associated with an increase in mortality or serious complications such as stroke, myocardial infarction, DVT, or PE. There remain unanswered questions. For example, we identified high-risk patients based on a number of characteristics. The characteristics themselves, however, were not identified with relation to timing of the surgery. So as we mentioned in the paper, a patient who had a stroke 5 years ago was considered the same high-risk patient as a patient who had a stroke 3 months ago, as these were identified based on coding. It's also possible that there are unique high-risk features that change the safety profile of TXA. We were not able to detect those differences because these are relatively rare frequency characteristics. Perhaps in the future, with enough patients, each individual high-risk characteristic can be individually investigated. We thank you for your time and hope that you enjoyed our study.